My name is Pangilinan, and this is my abstract titled The Increased Risk of Post-Extubation Stridor in COVID-19 Pneumonia. Mr. Calais has disclosures for Continue Ed and Lung Pacer Medical. Severe COVID-19 pneumonia results in prolonged intubation, frequent use of prone positioning, and increased body mass index, which pose as increased risks for post-extubation stridor. There's scarce literature surrounding PES in COVID-19 pneumonia. Risk factors for PES include female gender, prone positioning, prolonged intubation, critical illness, morbid obesity, endotracheal tube size, height, and documented traumatic intubation. Previously, the reported PES incidence was 1.4% at our institution. Dexamethasone, a prophylactic treatment for PES, was adopted as treatment for COVID-19 at our institution after the release of the recovery trial. This retrospective cohort study is aimed at measuring PES risk in COVID-19 pneumonia and identifying independent risk factors for post-extubation stridor in this population. This was a single-center retrospective cohort study. Inclusion criteria were intubated adult subjects with PCR-confirmed COVID-19 pneumonia who were mechanically ventilated greater than 48 hours. Exclusion criteria were subjects who received a tracheostomy, were deceased, or transferred to an outside hospital without a prior extubation trial. The effects of dexamethasone on PES risk were classified as administration within 6 days of extubation. Categorical variables were compared using a chi-square test. Continuous variables were compared using the Wilcoxon-Rank sum test. Univariate logistic regression was used to measure association between risk factors and PES. To adjust for confounding variables, multivariate logistic regression was done. The alpha was set at 0.05. The results showed that PES occurred in 14% of 69 enrolled subjects, 40% of whom required reintubation, 5 of 39 cases male, and 5 of 20 cases female. Stridor occurred within 16 minutes of onset. Reintubation occurred within 24 minutes after a trial of 1 or 3 nebulized racemic epinephrine treatments, 60% versus 40% respectively. Median mechanical ventilation days tended to be greater among PES subjects, 18 versus 8 days. PES subjects had a tendency towards morbid obesity, with a median body mass index, 35 versus 31, and a tendency to require more prone positioning, 80% versus 56%. Dexamethasone showed no impact on post-extubation stridor in 41% of the subjects receiving treatment, 13.8% versus 14.6%. Univariate analysis showed that mechanical ventilation days in PES was not significant with an odds ratio of 1.06 and a p-value of 0.10. Mechanical ventilation days and gender had a significant association with the increased risk of post-extubation stridor when adjusting for age, BMI, and height in the multivariate analysis. Mechanical ventilation days resulted in an odds ratio of 1.11 and a p-value of 0.02, and female gender resulted in an odds ratio of 12.1 and a p-value of 0.04. In this graph, a linear increase between mechanical ventilation days and PES risk can be seen in the univariate model. We found that patients with COVID-19 pneumonia had a greater risk of post-extubation stridor in comparison to what we had previously reported, half of whom required reintubation. The adjusted model for mechanical ventilation duration significantly associated with PES. This pauses for concern due to the nature of prolonged mechanical ventilation in COVID-19 pneumonia. Both height and female gender were significantly associated. Dexamethasone used for COVID-19 treatment was not associated with a decreased risk of post-extubation stridor, which is surprising as dexamethasone is used prophylactically for post-extubation stridor treatment. The limitations of this study is that it was a small sample size. We concluded that mechanical ventilation duration was 2.25 times greater among COVID-19 subjects. COVID-19 pneumonia was associated with a higher risk of post-extubation stridor that reflected the interplay of increased mechanical ventilation days and female gender. And finally, that the administration of dexamethasone for treatment of COVID-19 pneumonia was not associated with the lower risk of post-extubation stridor. These are my references. Thank you.